Before I share my slides, I wanted to get just a quick sense of who's in the room and what perspectives we have. So I wonder, you can probably use the raise hand function for this. I'm going to ask a couple of questions and invite you to raise your hand if you fall into this group. So who here works in procurement? Anybody here working in procurement? Maybe flag your hand on the little hand icon. I'll give you a minute, 30 seconds to do that. I don't see any just yet. Okay. So perhaps nobody working in procurement. Hands up if you work in or around sustainability and are kind of seeking to influence your procurement colleagues. Perhaps you're sitting on the outside of procurement. Yeah, there's lots more people who are in that space. Okay, fab. So a few more people who are working in a sustainability space and looking to influence colleagues. Okay, brilliant. That gives me a really good sense of the room. Okay, in which case, let me start before I share my slides by saying who I am and a little bit of an introduction. As Kim said, I work with the Health Anchors Learning Network. I'm a senior associate with the Innovation Unit, and in that role, I co-facilitate the network. I, in particular, support a lot of the learning sets, which are kind of closed groups of about 10 to 15 individuals from anchor organisations across the UK who come together and go on a learning journey with us. And I also design and facilitate a lot of our public events alongside SAV. A couple of people just come off mute. If you could pop back on, thank you, that'd be fab. And I'm not a procurement expert, nor am I a sustainability expert, but I have done a little bit of work in both, in different capacities. And in particular, in the anchor work we've done, we've been working with participants from across the UK who are starting to kind of join those two disciplines, those two fields together. So I've kind of learned by osmosis. But if you've got hardcore technical procurement questions, I may not be able to answer them. But what I will do is share a few slides on our learning so far, which have come mainly from the learning sets, but also from a couple of big events we've done on procurement and net zero recently. And then hopefully we'll have time for a couple of questions at the end. So this first slide is really just, it's an icon or an image that we've developed, which we use a lot just to kind of set the scene for anchor organisations and really try and explain what the key levers are that anchors have at their disposal. So when we talk about anchor organisations, we're talking about those large place-based institutions that have often been in place for 100 years, hundreds of years in some cases, and are in that place for the long term. And their identity as an organisation is very closely tied to the locality. So they're not going to up and move if tax breaks are better in another country. They are usually very, very deeply rooted in localities and communities. And they often also have some of these levers which operate at sufficient enough scale that they can have a really significant economic, environmental and social impact. So while their day-to-day business might often be delivering services, you might typically think of kind of hospitals or universities or museums or schools as classic anchor organizations. And they're in the business of delivering particular types of services alongside and for communities. They are also, and we'll start at the top right, in the blue, really significant employers. So they're often one of the biggest employers in the area. They often have huge budgets, often exceeding, if you're working at the NHS trust footprint, exceeding £1 billion. They will often have a significant estate that they're working across, and sometimes they will be leveraging in or bringing in really significant financial investment for new infrastructure or estates or modernisation programmes. So they've got, again, influence over a lot of spending and where that spending goes and how intentional it is. They often, as a result of those three things, also have quite a large carbon footprint, environmental impact, and are in a good position to take action to reduce that at scale. They're often their kind of mission and focus is often very closely tied to that of other anchors in the area. So if they want to tackle health inequalities, they will often not be the only organisation who wants to do that. So they've got a kind of real opportunity to work alongside partners to increase their anchor impact at scale. And lastly, they're often very closely connected to communities. And in fact, depending on the area you're in, but particularly in counties and market towns, you may often have a really significant overlap between your workforce and your community. So they're not distinct entities. They're often, in some cases, a bit of a shared bit of the Venn diagram. And today, what we're going to look at is the intersection of procurement and spend in the yellow and reducing environmental impact in the green, and how those two dimensions of being an anchor organisation intersect. So, a few reflections first on what we're seeing and hearing from the Health Anchor Learning Network participants on this topic. And then I've got a tool that we created from the Net Zero and Procurement event we ran earlier this autumn, and then a couple of case studies to share. So I think what we've heard so far from participants about the work they're doing in this space is that it's often fairly early stages, but what they are doing is really, well, in many cases, taking a highly relational approach. So they are starting to have conversations with suppliers and starting to think about doing some analysis on which suppliers they have most impact with and which sectors or industries. So, for example, they may be looking at the suppliers for whom which they contribute a significant amount of that supplier's income, where they are likely to have more leverage or opportunity to influence, and starting to have conversations that may be something like, what are your interest, what are activities you're already doing on reducing or moving towards net zero, reducing your environmental impact, what's happening in your sector, what are some of the barriers you're facing. So some of those introductory conversations, and they are starting to kind of do that at scale. So some of them are starting to do that at scale with particular sectors where they might have a large number of contracts, and they're starting to do that earlier on in the contract process. So if they do market engagement work, they might be talking about their environmental sustainability ambitions and their journey towards net zero at a much earlier stage. And a lot of the participants that we work with are also starting to try and gather data to help them understand what the lay of the land is, and in particular try and help them understand what suppliers have already got in place. So some anchor organisations have applied simple audit tools, or and what that might look like really is a survey or a set of questions that they're sharing with providers that go along with their quarterly contract monitoring, to just ask a couple of questions about what are you doing on moving towards net zero, what have you got in place, do you have a sustainability policy in place, have you got particular areas of your business where you're seeking to move towards net zero, or where you have the biggest impact. So starting to have conversations in different ways and gather a bit of data about what's in place. So that's kind of often where people are at right now. The wider context and what's going on in this space is something I think many of you will be familiar with, but there is a kind of fairly clear set trajectory, certainly for health anchors, for NHS anchors. And of course, health anchors will be working in partnership with local authority anchor organisations, sometimes with universities or higher education. Each sector will probably be working to slightly different timeframes, but may well be kind of ultimately aiming to end up in the same place. So this information here is probably not new to you, but I guess the one of the key things I would pull out is the kind of from April 2027, all suppliers being required to publicly report on their targets, emissions, and publish a carbon reduction plan. I think given what we're hearing from HALN participants at the moment, that is going to be a pretty steep jump for some sectors and some suppliers. And there's some particular concerns about how best to support SMEs and the voluntary sector. Some of the reflections we've heard both at the recent event we held and in learning sets is that often the very large suppliers are pretty well equipped on this front, and they have staff in place and resourcing, resourcing that enables them to analyse where they can make an impact and start to kind of put that in place. Smaller organisations don't necessarily have that resource or infrastructure at the moment, so that's definitely something which we're hearing is an area of concern. And this is a kind of tool that I'll talk through briefly and we can share after the event, which came out of this public event that HALN held earlier this autumn, which was about net zero and procurement, with kind of 2 case studies, which I'll present if we have time, from the City of London, so local authority, sustainable supply chain manager, and also from Alex Hammond, is it Hammond? Alexandra at the NHS procurement team. And we did some analysis both of what those 2 individuals presented and shared, and also the kind of dialogue and conversation that participants were having. And there's, I guess, there's 3, the blue, the orange and the green, 3 main areas where health anchors can leverage their procurement or their spending to meet sustainability goals. The first area is around kind of signalling and intent. So that kind of communication piece that you're starting with your suppliers. The second is gathering quality data to inform action. And the third is moving towards maximizing your impact. And I guess I'll start at the top there. So some of the typical activities that people are doing in order to signal their intent and start to have these conversations with their suppliers are getting much clearer about their own social value objectives and any particular environmental areas of focus that they have within their own strategies and organizational policies. Signposting suppliers towards resources, including the NHS Net Zero Supplier Roadmap, but there are others as well. Starting to think about embedding sustainability into external communications. As I said, some of them, if they're at a very early stage of procurement, might be doing market engagement activity work, and they might embed some of those expectations and language in those communications. And then really getting into the kind of paperwork, nuts and bolts side of things, they would then be looking at how do we turn that intent, that strategic intent, into questions and scored answer, a scoring system that we are then reflecting in the decisions that we make about how we award money and what role do our sustainability questions have in the overall scoring and awarding of contracts. But it's not just, I think often people go towards the tender documentation as the kind of first point of call, but actually and that is important for future contracts, but there will be large amounts of spending that are currently in existing contracts, some of which may be running for many years. And that's where the kind of conversation piece is so important, because you can have a lot of influence outside of the kind of formal contracting process that may be happening for future suppliers with your current suppliers who are already working within contracts. The second piece there in orange, the gathering data to inform action. This has come out really strongly, and there's an increasing number of tools in the market that can help you, or can help suppliers look at their own impact, but also can help you kind of compare and contrast activity across suppliers. So the types of data that people are trying to collect are what suppliers are already doing. So for example, a proportion of suppliers who might have existing sustainability policies in place or carbon reporting tools. They in one case, people are using a tool called Evergreen, that's one that NHS is using. There are others around, and one of the questions we've heard quite a bit is how do you navigate which tools are best, and how do you then try and make sure that tools are accessible, affordable, useful, not burdensome for suppliers? I don't know the answer to that, but there are a few different ones that people are using at the moment. There's another one called Avani, which came up in the event, which a few people are using. So, gathering data to try and get a sense of, in different sectors and with different providers, what does the landscape look like? Where are they at on their net zero journey? Which sectors might have more of an impact in terms of their current carbon footprint, and so where you might want to intervene more? Which sectors do you spend the most money in? For which providers are you one of their biggest contracts or kind of clients? So all of that kind of data will really help to inform the type of approach you might take and where you might prioritize resources. And then the final area, kind of maximizing impact, that is again about thinking about who can you have the most impact with. So where do you contribute specifically to an organization's income? Where do you have the strongest relationships with suppliers? And where are there the greatest opportunities for meaningful interventions? I'll just briefly share these 2 case studies, which you can also look at afterwards in the slides, and then I'll stop and we can have a bit of a discussion about it. We heard from 2 organisations at this event, and actually I should say that the event, I'm pretty sure it's on YouTube as a recording, and there was some really interesting Q&A there, so feel free to have a look at the HALN YouTube page and dive in if you want to hear a bit more from both of these case studies who presented, and also the kind of Q&A that followed. But City of London, we had a presenter who is their sustainable supply chain manager, so quite a unique role. Not every organisation has that role. And she was talking about some of the ways in which they have really prioritised this work internally. And she works closely with procurement colleagues, but also very, very supplier focused. So they've changed their tender processes. They've increased the weighting of their responsible procurement question from 10 to 15%. And they have also shifted towards asking for more intentional and measurable change from providers. So they're asking people to share data with them and get very, very specific about what they're currently focusing on in terms of their journey towards net zero. She talked a little bit about internal engagement and how she's supporting procurement staff and then also contract managers. So she's very much kind of building capacity available to help support people, thinking a little bit about learning and training opportunities for internal staff, because it's not, you can put the kind of you can do the tender paperwork and you can score things differently, but actually if a contract manager doesn't then know what data they're looking at or how to hold a supplier to account on their reporting on their performance based on commitments they've made in their bid, then it's that is an important piece of the puzzle too. She's created a kind of quite cool interactive PDF type document, which is a low carbon procurement document, and that's intended to help staff navigate into relevant bits of information that they might need on hand. And as I said, they're using something called Avani, which is a carbon reporting tool. So that's something that suppliers can use to help them improve their identify and address their carbon inefficiencies, and also help City of London get better data and compare across suppliers. So that's the tool that they're using. In contrast, on the right-hand side, we had a presenter from NHS England Sustainable Procurement Team who talked a little bit about what's happening nationally, where there is, from 2022, there was guidance which required a minimum of 10% net zero social value weighting for all procurements. Pardon me. And they've published a net zero supplier roadmap, which is really helpful and sets out some of the expectations for suppliers and the timeframes that I touched on earlier. Pardon me. And they are using a tool called Evergreen, so a slightly different tool, fulfills a similar function, I think, to Avani. I will stop there so that we can spend the remaining 9 minutes having a bit of a discussion and potentially get some questions or hear your reflections on what you're doing and or challenges that you're facing in this space. So Kim, I don't know if you want to come in and do some moderation for us.
I will do my best. Thank you so much, Julia. I think that was a really helpful whip through of some of the information that's out there. We haven't got any questions in the chat yet, but do feel free to pop questions in or raise your hand if you want to ask Julia something. Or I know that you're also really interested in hearing about other people's experiences, aren't you, Julia? Yeah, I know that would be of interest. In the meantime, while we're waiting to see whether people have got questions, I suppose there's something, and you did mention it in one of your slides briefly, but there's something about the opportunity of how we engage with suppliers and how that's already happening and how those conversations then lead on to change. Is there any more that you could say around that area?
Yeah, I think that there's there's 2 dimensions to this. There's some of the engagement with large existing suppliers, which is probably the slightly easier side of things, where you can start to have conversations about where they're at on their journey, where they want to go, what support they might need. I think the bit that often feels harder to do and less developed is the kind of proactive engagement with potential future suppliers in a timely enough way, so that they have time to really put thought into their responses and their engagement with the NHS. So let's say, for example, you were wanting to contract. So let me give an example of some work I did in City and Hackney about 3 or 4 years ago, where we worked with a group of anchor organisations across health and local authorities. And in City and Hackney, you have the Homerton Hospital. And at that stage, they had a catering contract that was coming up for renewal. And they were thinking, wouldn't it be great if we could try and see this as an opportunity to do some procurement of a more kind of sustainable catering offer, and potentially work with local suppliers too. Now, without going into the details of what happened there, that's the kind of question that we don't often think about far enough in advance to do the engagement needed to identify and engage with suppliers who are doing really exciting work on sustainability, because they might not already be in touch with NHS framework. So there's a kind of information, there's a kind of communication gap. They won't necessarily hear about opportunities. And they may, if they're small to medium-sized organizations, not have the same resources as, you know, large organizations who have people in place who have kind of data at their fingertips and are very on top of what that organization is doing on sustainability. So I think there is a kind of, if you are spotting an opportunity where you may be able to embed organizations that can deliver on your sustainability agenda, just thinking about how far in advance you might need to start the engagement and how to reach some of the suppliers who may not already be involved, you know, on your kind of framework, or reaching out on kind of contract finders and so on. And that may require, you know, kind of typical things that people might do are Q&As and webinars, which are circulated across local organizations. And typically your local authority partners would be really good partners to engage here, because they might often have newsletters and mailing lists for local businesses. So they might be able to reach out to people that you can't reach out to or don't have contact with. Often kind of small traders associations or the local federation of business, again, might be the Chamber of Commerce. There's some of these kind of local industry bodies who might be able to really bring people in who aren't currently engaged with you yet. And I guess the other piece around supplier engagement is not to forget that sometimes you may have a contract with a prime provider or a main supplier who might then be subcontracting. So there's some interesting conversations to have about your expectations of who they engage with locally, or not necessarily locally, but on the kind of, you know, kind of how they engage, how they filter through those sustainability ambitions with suppliers that they're subcontracting with.
Yeah, there's definitely a lot in there, isn't there? And I know that there are some systems, I'm thinking especially Lincolnshire and Black Country I know about, who are working to engage a lot of local and smaller suppliers. And there's also been a bit of work recently on improving kind of EDI and diversity within the supply chain, which I think is, again, it's kind of a demonstration of the fact that this really is an opportunity for the NHS to influence beyond ourselves. Oh, Claire, I'm really glad you just put your hand up. I was trying not to call on you because I felt that was too mean, but I'm really glad that you've come in.
Thank you. No, yeah, so we are doing some really good stuff in the Black Country, but it's about what you've done today, Julia, and I think what you presented is really interesting, because I think our challenge isn't from a procurement perspective, because we believe we're doing some really good stuff, but how do we actively and meaningfully engage with the anchor institutes around us, because I think we've struggled sometimes to understand what we can do better synergistically than we do alone, and I think not having some clear metrics about what it is that we're trying to deliver collectively has been the challenge. And that's not a criticism of anybody within the Anchor Institute network. I think it's just that we've all got so many competing priorities. How do we focus on something that's going to give us the biggest bang for our buck and make the best use of our time, really? So I don't know if you've got any thoughts on that.
Yeah, well, just that I think it's a really rich space for collaboration, because obviously the one thing that you all share is your footprint and your locality, and you all share, you know, an ambition to move towards net zero, certainly with the local authorities, and I'm sure with lots of the other anchors. And I think in my experience, it's relatively rare that partnerships, collaborations, ICSs are having conversations at the right level. So I think there's a kind of who in the organisation can speak authoritatively to this, and it may often be a combination of roles. So the type of role you might have in an NHS trust might be different to the type of role who might be leading this work in a local authority, might be slightly different to who's leading this work in another type of anchor institution. So I think there's something about like who's leading this work within the organisations and what conversations have they had already. And I think one of the, you know, where there's real common ground is you'll often share the same, well, you will almost certainly share a lot of the same local suppliers. You might share different national suppliers or specialist suppliers if you're sourcing really, really technical stuff that only a hospital might need, for example. But for things like soft facilities management, catering, I don't know, goodness me, laundry services, some IT, you know, there will be like many things where you possibly are sourcing from the same pool, and you could be having shared conversations with providers about your kind of expectations as a system. I think that would be a really exciting area to see happen more. But again, I think it's when I've often convened anchor groups in a place across different types of institutions, the hardest thing for me has been finding out who's actually leading this work internally, because the roles don't speak to each other like to like necessarily.
Yeah,
but
that's very true. And I think we hosted a Meet the Buyer event last year, which was really successful, and we do want to run another, because that brought together all the anchor institutes and the right people in the same place at the same time. And then as a result of that, we've now got Find It in the Black Country as a platform. So we are buying from local suppliers, which is great. But yeah, I think that's a really good tip, Julia. I'll go back and have a look at who we've been speaking to and make sure that there's some cross-cutting of work. Perhaps that's been missed before. Yeah, so thank you for that.
Thanks, Claire.
Thank you so much, both. I think what this has really demonstrated is that this is only the beginning of the whole conversation, and there's so much opportunity here for influence and partnership and collaboration. So we'd love to hear from some of you about your experiences in this area. I'm aware people are going to have to start dropping off now because of time. So do drop us emails afterwards. You should all have my details, and Julia, if you're happy, then we can share your details on your presentation afterwards. As always, this will be available on Future NHS if you want to forward it to anybody else who's interested. I'll put a little bit of information about how you can feedback on this session and the series as a whole, and that's it from us. So thank you so much, everybody, for your time, and I hope to see you all at another Lunch and Learn soon.
Thanks so much, Kim. Thanks, everyone.